Coming up on Breakthroughs, we'll share one man's inspiring story that may just change the way you live your life. Plus, it's a real pain in the neck, discomfort of the spine or neck, but it can often be treated without surgery. And rehabbing your life with the help of Good Shepherd. It's all coming up on Breakthroughs.
Breakthroughs, Rehabilitation and Technology Today. Presented by Good Shepherd.
Hello, I'm Wendy Gillette. Welcome to this edition of Breakthroughs. We've brought you many miraculous stories on our past shows, but never one quite like this. When Daryl Good told us his incredible story of persistence and recovery, he moved everyone to tears. Daryl Good feared he would never take these steps. He contracted polio as a baby and grew up never being able to walk as others can.
This leg was 3 inches shorter. It was turned almost completely backwards. I actually walked almost bent over because I had to compensate by pushing this leg down and rolling down like this.
Daryl endured 5 operations and underwent intensive physical therapy. But even after all that, he was unable to walk in good form until he came to Good Shepherd.
The first week, they started teaching me how to walk, which foot went first, because I didn't know any of that. I've never walked before. So within a week, I was using a quad cane, just a quad cane. But they told me to continue to use both crutches because it made me level until I could learn how to properly walk.
Every day, he became stronger. Within weeks, he achieved a goal that once seemed out of reach.
I just took my first steps at 44. So I took my baby steps. And now I'm ready to run, but one thing at a time.
This past Thanksgiving, Daryl and his wife were thankful for so much. For the first time, he was able to walk without assistance in front of his mother. The emotional moment was captured on home video.
Oh my God.
Dreams like Daryl's are achieved every day in the Outpatient Neuro Rehabilitation Center at Good Shepherd.
Getting tired yet, Joe?
Patients who've had strokes, spinal cord or traumatic brain injuries, multiple sclerosis or other neurologic conditions rebuild their bodies and spirits here.
It's amazing to see how patients progress, and it's always exciting to have a patient like Daryl who's very motivated and excited to make gains.
The center features state-of-the-art technology, including what's called the Rio, a piece of sophisticated exercise equipment which increases motor control of the arm. There are only 10 such units in the country. There's also what's called the Balance Master, a device which gives feedback and helps retrain balance. All of this technology allows therapists to develop one-on-one programs individualized for patients just like Daryl.
When I come in here, every day I come in here, I'm so happy. I'm so happy. And the days I don't come, I miss it. This place really changed my life. It changed my life.
Joining me now to talk more about neurorehabilitation is Sue Golden, Regional Outpatient Manager. Thanks so much for being with us today.
Thank you.
So we saw you working with Daryl. That must be amazing to see his progress.
Oh, it is. That makes it all worth it to see someone going from not being able to move to being able to walk, engage in community activities, become a part of the family again. It's wonderful.
And you must see so many stories just like Daryl's.
Oh.
You live them.
Every day. Every day. That's what keeps us going.
Tell me about some of the more special events or situations that you've seen.
Oh, just recently, the other day, we had a 21-year-old paraplegic. We stood him up for the first time with long leg braces, and his mom wasn't there, but he was just about in tears. He's telling us to get his telephone and take pictures, and he's calling all of his friends. It was, you know, he said, I haven't stood in 8 months. This is incredible. And this was a gentleman that we had to actually talk into it. He kept saying, oh, no, this isn't worth it. And I said, you're a perfect candidate. And it was amazing. It was amazing.
What are the types of emotions you see? Obviously, joy.
Oh, from tears to, just, I mean, Daryl is running around kissing everybody, and when he comes to therapy, he yells, "Hi, honey, I'm home," when he comes through.
Well, that is certainly rewarding.
Yeah, it is.
What are some of the most common conditions that you treat and see there?
We see people who've had a stroke, spinal cord injury, head injury patients, whether it be traumatic or through a bleed in their brain. We also see amputees, as well as people who have a primary neurologic problem and then develop orthopedic problems because we have an expertise in gait and balance.
So we showed some of the technology that's very important there, the Rio and the Balance Master. Why are they so remarkable?
For a couple reasons. One, because certainly there is new research out there that shows us if you can do mass patterning of activities, you can actually regenerate in the brain. And I mean, gosh, if we can get people to walk better, move an arm better, quicker, it's worth it. And that's one component for the patient. The other component is so many times in therapy we really haven't been able to quantify and have objective measures that show progress. And as you know, as the medical field is changing and insurance regulations are training, they always want to know, tell me exactly how they're getting better, show me. And now for the first time, it's incredible. We have actual numbers that we can put to functional activities that we never had before.
Is there other state-of-the-art technology that we haven't shown yet? I'm sure there is.
Well, the Balance Master.
Yeah, we talked about that.
Okay. And actually next week, my staff will be trained in, it's called the BioNest for the lower extremity, which is electrical stimulation to use with patients to walk so that maybe in the future people won't have to use braces to walk. Because anytime you put anything on anybody, you're never going to get a normal walking pattern. And if you don't have that, it makes people have to expend an awful lot more energy just to move.
Mm-hmm. So the field is really changing. You're seeing developments all the time?
All the time. And a lot of research, not only in the States, but abroad. And we've been very fortunate that now companies are actually coming to us to be sites to trial new equipment. So that's really exciting.
We talked a little bit about the reactions of patients when some big miraculous event happens. What about their families? What do you see from them?
Oh, you see the gamut, We try to involve families as much as possible, and we've seen the tears, we've seen the frustration, and as you're treating patients, you're actually treating the family along the way. They go through the exact same emotions as the patients go through. So you have to bring them along, whether they attend therapy or you make a phone call or you stop out in the waiting room and say, hey, today they actually walked 15 feet without me having to hold on to them. Those are huge steps, because it's such a long process.
It certainly is. Every time I've talked to you, you talk about your therapists and how proud you are of them. How big a part of the team are they?
Well, every person, I mean, from the aides to the secretaries are absolutely a part of the team. We couldn't make it work. And because these people have so many different types of problems, it really takes a coordinated effort to reach our end goal together. And so it's wonderful that for the first time for us in the New Health and Technology, we have everybody there.
All right, thanks so much for joining us today, Sue.
Thank you.
And next on Breakthroughs, find out how you may be able to relieve your ever-present back pain. We'll be right back.
With outpatient rehabilitation at 15 convenient locations, Good Shepherd is your key to independence.
Good Shepherd is rehabilitation.
More than 200 outpatient rehabilitation therapists means quality care from start to finish. Good Shepherd is rehabilitation.
There's something you should know about me. I'm not easy to live with. In fact, I have a really ugly side. I don't always let you speak when you want. I can leave you feeling shaken and confused. And if you ignore me, I might lash out, leaving you dead. I am a stroke.
Learn to recognize a stroke and act quickly. Time lost is brain lost.
For more about the powerful link between technology and rehabilitation, check our website, goodshepherdrehab.org. Get the facts on technology-driven rehab with helpful information about stroke recovery, pediatrics, sports injuries, and much more. Also see our section on Rehability, your optimal living store, for products and services that open amazing lifestyle possibilities.
Welcome back to Breakthroughs. Back pain affects an estimated 80% of Americans at some point in their lives, but it doesn't have to result in surgery. Good Shepherd's new spine center aims to make life less of a pain in the neck without worrying about a future operation.
Hey, all right. Just fine here.
How's the pain?
A lot less.
Good.
Almost 100%. You've done a wonderful job.
Just a few months ago, patient Bill Gillingham couldn't tell Dr. Kumar Raj he felt fine. Last year, Bill started experiencing severe back pain. He visited Good Shepherd Spine Center and learned that arthritis was eating away at his back.
I had a hard time lifting anything. I had a hard time sitting. If I had sat too long, I couldn't walk more than a couple blocks.
Okay, what's happening is your discs are changing.
Bill decided to put his trust in Dr. Raj.
He was certain that he could help me. Well, believe me, he has helped me. He's done more for me than any other doctor could have done.
Bill underwent intensive physical therapy and also started receiving shots to ease the pain. His progress is laid out on this chart. Each yellow smiley face represents a day his back felt good. The smiles nearly take over the page.
My back is now almost as good as it was brand new.
Dr. Raj says Bill's situation is common.
By the age of 20, 50% of the Americans suffer from back pain. By the age of 80, at least 80% suffer from back pain. And back pain is so common, it's number 2 reason for doctor visit, next to cold.
A patient who visits the spine center first undergoes a thorough examination and explains their medical history. If the pain is due to a muscle spasm or strain, they're prescribed a program of physical therapy. If there's no improvement, the next step is interventional pain treatment.
Ranging from neck injections, back injections called epidural injections, then diagnostic and therapeutic blocks for a variety of joint conditions.
Dr. Raj says most back pain can be treated without surgery. There are cases that require surgery, but the majority of patients at the Spine Center won't have to endure the pain, worry, and recovery of an operation.
According to the Journal of American Medical Association recently published study, they compared a patient who suffered with back pain with non-operative treatment and surgical treatment. They found there was no statistical difference in the study. So patient got better more with non-operative treatment.
Dr. Raj says state-of-the-art equipment at the Spine Center and experienced staff help patients receive top-level care.
They're concerned about you all the time. When you're at home, how are you doing? After you get a shot, how are you doing? How do you feel? You got a fever? Does it hurt you? I mean, they are most concerned here at Good Shepherd than any other place that I've ever been.
The best way you can avoid back pain is to maintain good posture, watch your weight, and follow a healthy lifestyle. The payoff is huge because Dr. Raj says back pain can affect your personal relationships, your work, and all of your day-to-day activities. Easing the pain certainly altered Bill Gillingham's world.
Now I can wash the car, and now I can take a walk. I mean, I used to only be able to walk 2 blocks, now I can walk a half mile, which is a great improvement to me. So I feel good about it.
Joining me now to talk more about the Spine Center is Dr. Philip Bryant, Good Shepherd's Chief Medical Officer. Thanks for joining us today.
Thank you, Wendy.
You were instrumental in developing the Spine Center. How did it come about?
It came about because we identified a need in the region. Good Shepherd already provides, I think, excellent and comprehensive back care, but it doesn't provide interventional or hadn't provided interventional spine care prior to the development of this spine program. And now we have a very comprehensive state-of-the-art program in place available for the individuals in the region. They don't have to travel out of the region to get this service. So we're able to provide them non-operative care in a very comprehensive way.
Yeah, Dr. Raj had said that some people have to travel, in the past had to travel as far as Philadelphia to get that kind of care.
Exactly right.
So now?
We wanted to make it immediately available, and some of these procedures actually require repeats, and to have it available immediately in the area is, I think, a great plus for individuals living in this region.
In the story we just saw, we saw a little bit about the kinds of treatments that you provide at the Spine Center. Tell me a little bit more about that.
Sure. We provide much of the conventional, sort of the state-of-the-art standard of care in terms of the therapies that many people are used to, moist heat, range of motion, therapeutic interventions like massage, osteopathic manipulation. We also provide medicinal care in terms of prescriptions of medications. But up until this period of time, we hadn't been able to provide interventional spine care, and now have state-of-the-art equipment and the expertise to do so. This combination, I think, really provides a nice assortment of treatment modalities for individuals that they really didn't have available before.
When you talk about interventional treatments, explain that.
Sure. Individuals who present with back pain can present for multiple reasons. Some of it is due to musculoskeletal reasons, and some of it may actually involve some nerve problems. The interventional spine therapies allow us to do injections with a steroid and an anesthetic in a specific location to specifically address the point of pain. And we provide epidural injections, facet blocks. We can also do more sophisticated blocks as well, but those are the conventional ones that people would be most typically involved in receiving.
Why do you think the Spine Center is important to the community?
Well, back pain is a problem that affects virtually everyone, and most individuals, both men and women, will experience a significant bout of back pain, at least one episode, and sometimes more in their lifetime. And to be able to provide a service like this in the community, particularly readily available and a well-established one in the community, I think is a great benefit to those here.
What has been the reaction from patients?
Actually, they've been very excited about having this opportunity and available to them, and to have it so readily available to them here. And we're excited to be able to offer that service to people here in the region.
Could the Spine Center be expanded to other parts of Good Shepherd?
There's no question that we can do that. We have multiple sites, currently 28 different sites that we are currently expanded to, and we have about 22 outpatient sites. We certainly are anticipating being able to provide that service in at least one or more of our outpatient sites.
And what other future plans are there for the Spine Center?
Well, we've already begun to be busy, and we've already begun to have a volume that was greater than we actually anticipated at such a short period of time. So we'll be recruiting additional physicians with this expertise in the future.
How many physicians are there now?
Right now we have Dr. Raj, who was mentioned earlier, is the only one currently with that specialty experience, but we are actually recruiting and have recruited successfully another individual who arrived this summer, and then we have a third individual that we are also recruiting as well.
The Spine Center, obviously part of the Health and Technology Center. Why is it important to have everything together in one place?
Well, we wanted to put them together because we know that individuals with back pain have a variety of etiologies, and to have access to multiple services in the same facility means that they don't have to travel anywhere else. They can get it all in one place.
Why is that important?
Well, I think what people are finding is that when they have to go to medical care to multiple sites, it's labor intensive, it's difficult, it's hard to get off work, very inconvenient for them. The other nice thing is that we communicate with each other within the same building. So the therapists and the physicians that are involved in the imaging center that's present there, everyone speaks to each other, everyone knows the individual. We don't have to re-ask the same questions to the patient. I think it makes it much more convenient for them.
All right, thanks, Doctor, for joining us today.
Appreciate that very much, Wendy.
And coming up next on Breakthroughs, we'll show you products available at Reability, your optimal living store, which could help you live better. What they are when we return.
A few years ago, Eric Oberman was a healthy college student. Then ALS, Lou Gehrig's disease, took away his ability to move, speak, and breathe on his own.
That is why the ALS Association has created Treat ALS, a program to accelerate drug discovery and clinical trials leading to new therapies in ALS.
People like me, people with ALS, need your help.
With your support, we can triumph over ALS.
With more than 200 outpatient rehabilitation therapists, Good Shepherd is with you every step of the way. Good Shepherd is rehabilitation. With your choice of 15 convenient locations, Good Shepherd Outpatient Rehabilitation is always within reach. Good Shepherd is rehabilitation.
Some dreams are universal. Dreams that inspire us. Multiple sclerosis is a devastating disease that changes lives forever. The National MS Society does more for people with MS than any organization in the world. This is why we're here. Because nobody dreams of having multiple sclerosis. Call 1-800-FIGHT-MS.
Did you know the statue near the Health and Technology Center shows Good Shepherd founder Conrad Raker and Bonnie Stallman, who has been a Good Shepherd resident for more than 50 years. The bronze statue, created by international sculptor Carol Nicholas, weighs almost half a ton.
Welcome back. Time again for Sean McHugh from the store Rehability. What'd you bring us today?
Wendy, today I have some wonderful pain management solutions.
Always a good thing.
Starting with the basics, we have a cold pack. It's heavy duty. It's very similar to the ones that we use in our therapy departments, and the patients are always inquiring, asking the therapist, where can I buy that? Well, we got them from a medical supply company, couldn't plug the people in to get them, so we'd use them, they loved it, and then we couldn't send them home with it. Now we've got them in the Rehability store. They come in a number of different shapes and sizes. They pop into the freezer, and they can be easily wiped off. It's a nice heavily vinyl. They last a long, long time. It's a wonderful piece.
I guess that's the advantage of it, that it lasts a long time.
And then its complement is another type of pack that can be either refrigerated or put into the microwave. It's hot and cold. It's stuffed with some nice comfortable beads. Also comes in a lot of different shapes and sizes as well.
It smells good.
A nice thing about these, it's great. This one's peppermint, chamomile, spearmint. There's a whole bunch of lavender.
And I'm sure
lots of different choices.
When you heat it up, you can really smell it.
Probably smells the whole room.
Yeah.
Aromatherapy as well as the hot and cold. That's great. And the therapists, who are also where we got so many of the recommendations about what should we stock in the Rehability store. So products like this. This is it's called BioFreeze, and it's just a pain relief spray, and it's recommended and again used by the therapists in the therapy gyms. So after people have their therapy, they can hit the Rehability store on the way out the door, buy a bottle, take it home, and then they're using the same product that their therapist used and recommended.
Yeah, this stuff is great. My chiropractor uses this.
Have you used it?
Yeah, really works well.
And getting on the subject of back pain, so many people have so many issues with back pain. This little pillow is a posture curve lumbar support cushion. You can use it in your car. You can use it at your desk at work. It's got a nice little strap on the back so that you can attach it to the chair and it won't flip off. It's got a nice contour and curve so that it fits right in that snug portion at your lower back and gives you that extra support and a little bit of comfort that you need to take away some of the pain.
So I'd imagine it's good if you drive or sit a lot.
Drive, sit, wherever you sit for a long period of time and need a little bit of extra support, this will take care of that. We have a lot of different supports and pillows and cushions at the Rehability store that can be used for that and many other purposes. And it's so important with your back. One of the best things we can do in pain relief is be a little preventative about it. When you lift something, lift with your legs. Don't bend over and pick it up with your back. And you could prevent getting yourself into a situation that may require therapy.
Right. And if you do have pain, you've got a couple devices here in case
Yeah, moving into the massage area, we have a lot of different choices on that in Rehability as well. This little piece, just a little handheld massager, and just put it in your fingers and rub it wherever you need a little bit of pain relief. You have any knots in your back at the moment?
Yes. Thank you, Sean.
Just give you a little rub there. And
It's nice.
It is, it's really nice. Very simple little device, but you know, the reward that you get is, you know, it's more than simple. It's wonderful.
And real quickly, just tell me what this is.
This is called a back knobber. You can use it to get the knots out of your own back. You don't have to bug, you know, your significant other or someone to do the rubbing for you. Want to give it a try?
Yeah, I'll use this one. All right. With that, I think we got to go to break. We'll be right back with more from Sean.
Nobody likes me. Nobody. Maybe it's because I like to attack people. Men, women, kids. I can reduce them to weak, stammering, confused, scared imitations of their former selves. If they don't stop me, I just might leave them that way for life. I am a stroke.
Learn to recognize a stroke and act quickly. Time lost is brain lost.
Hi, I'm Kirk Schilling.
I'm Shonda Schilling for the ALS Association.
ALS, or Lou Gehrig's disease, is a devastating illness that robs patients of the simple joy of playing with their kids. It destroys their ability to speak, walk, and breathe.
But there is hope. The ALS Association offers the most comprehensive patient services and leads the field in research. Please join us in lighting the way for a treatment and a cure.
Here's how you can get more information about ALS and the ALS Association.
More than 200 outpatient rehabilitation therapists means more ways to deliver customized care. Good Shepherd is rehabilitation. With 15 convenient locations, Good Shepherd brings outpatient rehabilitation close to home. Good Shepherd is rehabilitation.
And welcome back for more with Sean. Sean, what do you got here?
We have some outstanding exercise equipment at Rehability. This is one of my favorites. It's a pedal exerciser. You can use it to exercise your upper or lower body. Just set it on a tabletop and give it a crank. Does your upper body. You can use this knob to adjust the resistance, make it harder. When you're through doing your upper body exercise, you can set it on the floor and use it for your legs.
And you can make it as easy or hard as you want.
Simple as turning the screw.
Okay, and what you got here?
That's a yoga mat. Yoga is very popular right now in all the gyms. And we also have instructional videos that can tell you how to get started and take you through some basic routines.
All right. Thanks, Sean, so much for joining us today. Sure. And thank you for joining us for this edition of Breakthroughs. If you'd like more information on any of the topics we've discussed on today's show, check out our website at goodshepherdrehab.org. I'm Wendy Gillette, hoping you experience some breakthroughs of your own this month.